Hello, my name is Dr. Dewan S. Raja. Today I will discuss about drug-induced lupus erythematosis, also called DILE. An SLE-like syndrome may develop in patients receiving a variety of drugs. Many of these drugs are associated with the development of anti-nuclear antibodies, but most patients do not have symptoms of SLE. For example, 80% of patients receiving procainamide is a drug used in case of cardiac arrhythmia, receiving procainamide test positive for anti-nuclear antibodies, but only 1/3 of these manifest clinical symptoms such as arthalgia, that is pain in the joints, fever, and serositis, inflammation of the serous membrane like the pleura or the pericardial lining or the peritoneal lining. Although multiple organs are affected, renal and CNS involvement is distinctly uncommon. So, in case of SLE, kidney is affected, central nervous system is affected. In case of drug-induced lupus erythematosus, usually the kidney and central nervous system, the brain is not affected. So here is the list of drugs that may trigger SLE. This is a list. We have also, other than this, we have also some other drugs may also trigger SLE. So let us go through the drug and where they are used. Like procainamide, this is a medication used in the management of cardiac arrhythmia. This is an antiarrhythmic medication. Hydralazine, a medication used to treat high blood pressure. D-penicillamine, used to treat Wilson disease. Wilson disease is a disease of the defective copper metabolism, deposition of copper in the cornea as well as in the basal ganglia of the brain. So this work there as a chelating agent in Wilson disease. It removed the excess copper. D-penicillamine is also useful in the management of inflammation of the rheumatoid arthritis, joint pain. Rheumatoid arthritis, one type of joint pain. Ethosuximide, this is an anticonvulsant drug for absence epilepsy. Methyl-dopa, antihypertensive drug, medication. Minocycline, antibiotic used to treat various bacterial infections, including acne. This is a type of tetracycline. Quinidine, that is also an antiarrhythmic medication. Chlorpromazine, this is an antipsychotic medication. It was very popular to manage psychosis and as well as the schizophrenia. Terbinafine, this is an antifungal medication. Infliximab, there is an anti-tumor necrotic factor drug, okay, for management of arthritis. Crohn's disease, a disease of the GI tract, okay, and there may be fistula formation in Crohn's disease. Ulcerative colitis, another chronic inflammatory disease like Crohn's disease. Here there will be ulcer formation, particularly in the large intestine. Crohn's disease may happen in any part of the GI tract. Ulcerative colitis usually is the disease of the large intestine. So this is the drug infliximab used to treat this, and this all medication may trigger systemic lupus erythematosis. But idea is that not every patient will have, everyone who is taking this drug will have the SLE. Only a few percentage of the people who are taking this medication may have systemic lupus erythematosus. Drug-induced lupus erythematosus. Okay. Although multiple organs are affected, we already discussed that kidney and central nervous system is involvement is usually rare. There are serologic and genetic differences from classic systemic lupus erythematosus from that of the drug-induced lupus erythematosus. Antibodies specific for double-stranded DNA are rare, but there is an extremely high frequency of antibodies specific for histone. So, anti-DS antibody, dsDNA antibody is rare, but certainly antibody specific for histone is very frequent in drug-induced lupus erythematosus. Okay. DILE or drug-induced lupus erythematosus typically resolves upon discontinuation of offending medication. So we may not need treatment. We just withdraw the offending medication, then the signs symptoms of drug-induced lupus erythematosus will disappear, maybe by few months, maybe by few weeks, but discontinuation of the offending medication is the treatment. Okay, sometimes some patients may experience persistent or recurrent symptom. That part should be treated by the physician. They may need steroid therapy. In such cases, further evaluation and management by a rheumatologist or other specialist familiar with the autoimmune disease may be necessary. Drug-induced lupus erythematosus. These drugs are thought to trigger lupus-like symptoms by various mechanisms. So what is the mechanism of action of this drug which mimic the features of systemic lupus erythematosus? Drug metabolism leading to formation of reactive metabolites. Okay. Direct effects on the immune system. These reactive metabolites of the drug will work on the immune system and they will alter the DNA function. Okay, this is the mechanism of action of the drug by the metabolites of the drug that work against the immune system. It is important to note that not everyone who takes this medication will develop DILE, that is drug-induced lupus erythematosus, and the condition typically resolves upon discontinuation of the offending drug. If you are on any of these indications and experience symptoms suggestive of lupus, it is essential to consult with a physician or professional for proper evaluation and management. That's all for drug-induced systemic lupus erythematosus. Again, usually antibody against histone is very much common, but antibody against the double-strand DNA is rare or less, but almost all cases will get anti-nuclear antibody. Kidney system and the central nervous system are usually not affected, and management is easy. Just withdraw the offending medication, then the symptom will disappear. Mechanism of action is the metabolites of the drug. Those drugs work against the immune system. Okay, and that's all about the drug-induced systemic lupus erythematosus. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.